I'm Dr. John Ray. I'm an orthopedic spine surgeon in Fort Collins, Colorado, with additional practices in Alliance and Lexington, Nebraska. I practice in Fort Collins, but also fly into Lexington and Alliance, Nebraska. I've been a spine surgeon for greater than 20 years. I enjoy all varieties of spine surgery. We do an awful lot of necks, low backs, bread and butter type spine. I do complex reconstructions, frequently operate on people who've had multiple procedures before, but I also very much enjoy and do a lot of minimally invasive spine surgery and motion preservation surgery using disc replacements, etc. Today I want to talk to you about sacroiliac fusions. People commonly have sacroiliac pain from dysfunction, whether that's related to a prior infection, childbirth, just normal age, or prior trauma. Sacroiliac pain can be extremely debilitating. It can hurt over the gluteal musculatures on the back. It's often misdiagnosed as just common low back pain. It's often associated with common low back pain. It may show up as a result of a prior fusion. You can imagine that if your back is fused together, bolted together, that increases the stress on the lower aspect where your sacrum meets your ilium, right in the middle of the pelvis, and gives you pain that people often call hip pain. They will frequently be referred by hip specialists and other providers for a diagnosis of low back pain, etc. But simple tests in the office, in addition to a careful history and physical, may well identify this as sacroiliac dysfunction. We try to treat sacroiliac dysfunction conservatively and often successfully. The first thing to do with sacroiliac dysfunction is to try anti-inflammatories. Those may include non-steroidal anti-inflammatories, but also steroids. Everybody owes themselves a trial of physical therapy. Should those things fail, then we would proceed to injections. The beauty of an injection into the sacroiliac joint is, number one, it will hopefully provide lasting relief, but number two, it serves as a diagnosis. If a patient has greater than 75% pain relief by a sacroiliac injection, and if we can do that twice, then both the physician and the patient are often convinced that we're barking up the right tree and we're dealing with sacroiliac dysfunction. The sacroiliac joint is a large joint in the middle of the pelvis. It supports all of our body weight. It will hurt when we're standing on one leg, climbing stairs, hiking, walking, rolling over in bed, and commonly you may notice it if you cross your legs. That puts a lot of pressure on that joint, and this is a diagnostic tool that we use in the office frequently. The sacroiliac joint doesn't move very much, but it does move. And if the movement is abnormal, if it's painful, it screeches like a loud hinge on a door, like a bad bearing, and that screech is the pain that you feel. And the best thing that we can do then is to eliminate that painful motion. We would only do that after an honest and thorough trial of more conservative measures, but if you're to that point, this can be a real lifesaver for you. Sacroiliac fusion, fortunately, can be performed through a 2-inch incision with the patient completely asleep. Patients will frequently feel better as soon as the procedure is over. It's important for us to caution them to not take immediate advantage of this because we still want the bone to grow together into what we call a fusion. If you feel like you have pain from sacroiliac dysfunction, please give us a call. We'll review the diagnosis, conservative measures, and possible surgery. I'm Dr. John Ray. I practice in Fort Collins, Colorado, Alliance, Nebraska, and Lexington, Nebraska. If it's hard for you to come in, we can set up a computer meeting with you through telemedicine. We'd love to help you. Please give us a call.